Welcome back to another episode of Dating Chronicles. Well, today I'm going to have a little bit of a different take on dating, and we're going to be talking about menopause and how menopause affects us as women and our relationships. And I've brought two leading experts today, Dr. Priyanka and Irena. And they are going to introduce themselves and tell us a little bit about who they are and what they're doing. Irena.
So I go first. Hello to everybody, and very nice to be here. Katrina, thank you so much for organizing it. So I'm Irina Bond, and I'm a well-aging expert at Medigene and at Hortman. And I've been in health services for quite a while, since from my days in London. So 2015, when I set up my Purify and Cleanse Juice Detox company, and we provided our patients, our clients rather, with healthy juices, vegetable-based and fruit-based. And that's where I learned a lot about nutrition at CNM and worked with private clients on a regular basis, making sure that they are losing weight, making sure that they living longer, healthier, have a good health span, and looking good also at the same time.
Amazing. And Dr. Priyanka.
Hi, I'm Dr. Priyanka, gynecologist. Thank you, Katrina, and thank you, Irina. So I'm so happy to be here. Conversations are so important.
They are.
I've been a gynecologist for more than 20 years now, and I was working in the hospital. That's when I decided I need to move out of the hospital, move into the community, reach out to as many women as I can. And that's when I moved to the Middle East, because Middle East, you're in the middle of the world, and I can reach out to as many women. Because for me, I think prevention is so important. We struggle all our lives as women from when we are younger, dysmenorrhea, period problems, and then, the reproductive lifespan, and then menopause hits you. You really don't know perimenopause and menopause when it hits you. So I thought, okay, this is a time now. I need to make this change in my practice where I reach out. And then I met Medigene and at the Hartman clinics together. Our aim is that we reach out to women. We have a deep dive into their problems, their issues, their life. We do a personalized medicine kind of, a deep consultation. And we try to help them understand, is the problem related to their hormones? Is it related to insulin? What is it that's going wrong? Because sometimes it's like, a truck has hit you and they don't know what's happening. Yeah. So this is my mission now, that I can, through different platform conversations, reach out to as many women and, we get stronger together.
Excellent. I mean, I wanted to bring this topic in because there's a lot that's still unknown about it. And I work with both of you. I wanted experts to come in, and obviously as a gynecologist, I think it's very important because you can give us the hard facts. And I know I had some studies here that I wrote down, and it's saying that using the age of 50 as a proxy for menopause, about 25 million women pass through menopause each year, and an estimated 467 million in 1990 were postmenopausal in the world with an average age of 60. So that's around 36.8% of women that are menopausal at any given time through the whole world. And I thought that was astounding numbers.
Yes, absolutely. I could not agree with you more. And what do we think of as menopause? So for a 30 or a 35-year-old woman, menopause is, it's like at the age of 50 or 55, you just fall off a cliff, right? We never think that perimenopause. In fact, there is no data or statistics because you cannot define perimenopause. Menopause by definition is the day your periods are over, 1 year after that. So, hello, I'm not feeling well, but my doctor is saying that, no, you're not into menopause yet. Come back. Come back when you stop your period for a year. But it could be more than 8 to 10 years of your life, your precious days, when you don't know what's wrong with you. So if I talk about perimenopause, Could be just poor memory, brain fog. You're not able to remember your things. You don't know where you kept your keys. And then relationships, your children, your workplace, and the list is endless. So how do we then start, going back and look at where do we start educating women about perimenopause and menopause so that they don't have to wait till they are 55 or 60 or they fall down, have a fracture, they are on, bedridden, or they're having these mood swings, and then they go from doctor to doctor, polypharmacy, prescribed all kind of medications. Okay, I'm not feeling well. I have vaginal dryness. Okay, apply some moisturizer. No, that's not the thing.
I mean, it's interesting because I'll always remember, it sticks in my brain so vividly when I was probably 27, 28, and I worked in this clinic, and there was all these, you had to fill out the form, and there was these women that would say about menopause, and I would just look, and it was just so foreign to me.
So far away, it seems
far
to be,
away.
right? Yeah.
And even when I hit perimenopause, I mean, I can't really tell you I knew
Exactly
that
when.
much about it.
Yeah.
And, obviously being a holistic therapist for so many years, I didn't want to take HRT. I wanted to go the bioidentical route. And it wasn't until I was 50 that I went through some major stress in my life, and it knocked the thyroid out, which in turn knocked everything else, the progesterone, the testosterone, the estrogen. So I was on everything. And then I was overdiagnosed, and I got then hypothyroidism, where it goes overactive.
Yes,
Is
that's
that right?
hyperthyroidism.
Hyper,
Yeah.
sorry. And I came off everything cold turkey, and I was okay until it was probably around the age of 55 was my last period.
And-
so it happened very late for me. And up until that point, I was absolutely fine. I'd always taken supplements. I'd always taken care of myself. But when it happened like this, the flick of the switch was there. And just from 1 minute to the next, the minute I didn't get my period, boom, the hot flushes started. And I was working in
Quite
the Maldives
rapidly.
at the time, so it was hot anyway. And I really, for the first time, felt completely out of control of my body.
And sadly, when you have been taking care of your body,
It
you've
was
been
horrible.
healthy, you think you're eating healthy, you're
Horrible.
sleeping well. What just hit me? It's like the rug is being taken off my feet and I'm just going to fall down. And
So-
how do I, what do I do about
you
that?
two, you've got me on track through the bioidentical and through certain kinds of supplements. So, Irina, tell us, how can you do it holistically? How important is food? How important is supplements?
So, as we rightly mentioned, your preparation for your menopause, even though you don't want to think it in this way,
You think it will never happen?
it will never
but
happen.
it does.
But in a
Right.
way, it starts way before it's actually menopause comes into place. So it's like with longevity. If you want to live longer, if you want to have your health span much at better rate, you start preparing for it. Not at your in your 50s,
Maybe in
but
your
you
30s
start
or
in your
maybe in your
30s.
20s,
Maybe
absolutely.
even 25
Late
you
20s,
start
yeah.
that.
Yeah.
Of course, it doesn't mean that you are almost a saint or like a monk in a monastery, but it does mean that you do more of right things than a little bit slightly less right. So because
So
we do.
give us 5 things then, because
Yes.
if you're talking to a girl in her 20s, I mean, that's difficult.
Yes,
because they have
that's
no
difficult.
I have
comprehension.
two girls, yeah, right. I have two daughters. So one is 21 and the other is 18. And I don't try to be a hyper parent, but I just keep gently telling them.
Just gently,
yeah,
also
like
slightly.
I was saying, rather than a helicopter parent, I become a drone parent. Yeah. I am there all around, but I'm not there, and that's what I do. So I just kind of, slowly keep giving them my pearls of wisdom, or just tell them, okay, you want to have a cola? Absolutely. Why don't I share it with you? Or why don't we slip it slowly? So what we are talking commonly nowadays is like I talk about the 4S. Yeah. Very simple. Sleep, stress, sugar, and salt. Because for a 20-year-old, if I'm going to tell her a big list of, big diseases or thyroid or insulin, they're going to be like, let me live my life. But I just tell them, all right, when are you sleeping? how much stress are you living in, how do you eat, and how your day goes around. So slowly it just sinks into them that, okay, because I also, in my gynecology practice, many young girls we are seeing nowadays with insulin resistance. And this leads on to the polycystic ovary, irregular periods, and the whole can of worms, as you call it, right? So it's just bringing it gently to their notice that, all right, this is your labs. We are just doing this for you. So every opportunity in which, like I would even go back earlier, when should a young girl visit a gynecologist? Because a gynae visit is scary for most of the people, right?
Yes,
Like,
absolutely.
I don't want to go to the gynecologist. But how early? So maybe in their teens, when they start their period or something around when they're 15, just to check with a gynecologist to check what is your hemoglobin like, what's your complete blood count, your thyroid. And if I even, come back earlier in age, nowadays we are doing the thyroid test for newborn babies.
Wow.
Absolutely.
And how does that work?
So these are the learnings over all the years. So for newborn babies, we have started doing the TSH on day 4 or day 5, so that we can pick up any kind of thyroid like a hypo or a hyperthyroidism very early on in life. So not only do we do the thyroid testing in pregnancy, we are encouraging women to do the pre-pregnancy checkup before they get pregnant, right? So even coming earlier, most of the weddings are planned. That's what I tell the patients who come to me. Would you have an unplanned wedding?
No.
There
No,
was
of course.
a recent wedding, in India, they've spent so much and they've big thing, right?
Yes.
So you plan your wedding, you don't have it unplanned, plan your baby. So we do the thyroid test and all the tests as a pre-pregnancy testing. And for newborn babies, we're also doing the thyroid testing. And then
what-
of course,
So then what would happen then? I mean, on a newborn baby?
no,
what
if
would
we
you...
find that it is normal, that's good. But if there is a problem, then accordingly we can, if it's a hypothyroidism, the TSH is high, then we need to give them the medications and, so then we pick it up early on in life rather than someone who is maybe a 15 or a 20-year-old. Because
Okay. But is this genetic then?
it is genetic. Often it is genetic. So thyroid, insulin, all our estrogen, progesterone, testosterone, they are all interlinked. Our hormones are like messages which go from, so if you think of the brain gives an order. There are glands called hypothalamus and pituitary. This gives like a message or a text message to these different organs, pancreas, the ovary, to release the different hormones. And they are all like a beautiful Beethoven symphony, which is, throughout the life it plays. But when you are going to hit menopause or perimenopause, starting maybe at the age of 35, it goes little bit, starts going out of sync and out of tune.
Yes, that's true. But Dr. Priyanka, that our glands, we could stimulate and we could
Yes.
reactivate our glands so that our glands can produce some hormones that our body normally produce at the age of 25, 30, and let's say we are 40, and our hormone levels diminishing, and we could reactivate our glands with very active, and this is number one that we could do to prevent
Lifestyle.
perhaps our menopause from coming too early in our lives, very active breathing. This is one of the things that I've learned and done, very much valid for longevity and for health span. And I do believe it does postpone and perhaps not affect you as much in terms of symptoms, menopausal symptoms, at the age when you actually do hit menopause.
And I could tell you the science behind it.
Yes, absolutely.
Because we have the adrenal gland that is on the kidney. These are very tiny little glands. And these are the ones which will produce your cortisol, the stress hormone, which keeps us active during the day. And also the adrenaline hormone, which is for the fight or flight reaction. So how do
Absolutely.
you preserve your body's stress hormones, or how do you preserve your adrenal glands so that they keep releasing the hormones which help you during your menopause?
I want to ask the middle age spread. I never ever thought it would happen to me, and it did happen. And I was really beside myself as to what to do about it. And it's taken me a long time to manage that and get it in checked. So what is something that can prevent that from happening?
So, like we say that middle age spread, or we call it the food belly. Yeah, you're doing the exercise, you're eating the right things, but you're just gaining belly fat for no
Yeah,
reason.
yeah.
Yeah. In fact, I would even recommend from now onwards, we should, rather than checking our weight, we should check the waist hip ratio, which should be 0.8 for women. Right?
Okay.
The waist
Never done it in my life.
the waist measurement at the narrowest part and the hip at the widest part.
Yeah.
So that's important. That the middle age spread more commonly is because of insulin resistance.
Okay.
And insulin resistance is again on the rise because of stress, lack of sleep, too much sugar in our diets. We
Yes,
think we are
generally
eating-
very
yeah.
much sugar in our diet,
I actually
naturally.
don't mind
you know.
having that one. Even in the papers, it was I read yesterday that now the WHO has said move away from artificial sweeteners. The 1 teaspoon of white sugar is not as
Absolutely.
bad. It's good.
Yes,
but then
in comparison to artificial
the hidden
sweeteners.
sugar. So hidden sugar is something again which is causing insulin resistance. So at that point of time, whenever you eat something, our body will try to keep the blood glucose as normal as it can. So when you eat a lot of food with high GI, glycemic index, say for example, ice cream has a GI of 100. So you can, calculate the GI for the other kind of foods. So food with complex carbohydrates, say quinoa, pulses, lentils, fiber, vegetables. These foods are going to cause a lower spike. The spike of insulin as you eat would be not as high as
high
it
as
would be
normal.
if you're eating something which has high sugar. And as the insulin keeps because as you keep eating, we are eating a lot nowadays. We're eating too frequently and eating too much.
And too much, exactly.
Yeah, not doing that much of fasting. So when you are eating a lot, your body's insulin keeps spiking. After a point of time, the insulin receptors on our muscle cells, our fat cells cannot take in any more glucose. So insulin keeps rising, and that's insulin resistance.
So should we be
That could
fasting
cause-
more?
Exactly. Going back to fasting.
Yeah.
That's another point, the second point, that it could be done. If it done well and if it done controlled fasting and at the right time for you, for a person, for an individual, then it can be super beneficial for your longevity, first of all.
Absolutely.
And I do believe health span, of course, as a bonus, and also for your menopause, I do believe.
Or keep it like a time restricted eating. Right?
Absolutely.
You have
Time-
time
intermittent
of
fasting.
6 hours, or start with that, or start with 12 hours. Or at least if you've had your dinner, say late, you've gone for a party, you've had dinner at 10, then don't have your breakfast till at least 12 hours later. Right? That's, simple. And another point which I wanted to add was increasing sugar is causing a lot of liver disease.
Yeah.
Fatty liver, non-alcoholic liver disease is more common now than the alcoholic
Yes.
liver disease. So we are,
Wow.
and that's again
We're
the
getting
belly
into-
fat.
Absolutely.
So let's take it into relationship to do with menopause. So how is it affecting our relationships with our husbands, with our partners? Because you hear a lot of women say they think they're going crazy, they've got really bad mood swings, they get angry very easily, they get emotional very easily.
Yes.
So how can that all be tapered down so it brings you back to normality again?
Well, I think first of all, of course, physical side of us, we do need to check our hormones, because this is very much related to hormonal challenges that we face every day. But also, a lot of the times we can actually work on our being happy state a little bit more. These days, we think that being happy is given, whereas a lot of the times, perhaps
We have to find
induce
it.
that sense of gratitude, perhaps remind yourself what you're grateful for during the day, Perhaps, I know it's very difficult when your hormones are all over the place, and Dr. Priyanka will take over talking about hormones more, but from the perspective of like a humanity or a human being, a nice human being, you can do a lot, because you can do a diary with your mood
And sometimes just talk
and
to your
why,
partner.
and talk to your partner. Exactly.
I am going through
very
because as women
very
we
often it's
often want to
important.
multitask.
Yes.
We want to be perfect. We want everything to go on plan, but often life is different.
And
Life
men
happens.
don't understand.
Men
are
get
just like lost
testosterone.
in the dark.
Actually,
and
men
if you
get
don't talk to them, they would never do. They would
men
never
get the
understand.
testosterone every day in the morning. It's called a diurnal, right? For them,
Okay.
they sleep and they wake up in the morning and they have super levels of testosterone and they go and conquer the day. That's the drive that they have. But for women, especially in perimenopause, right? Estrogen, progesterone, it's fluctuating.
Yes.
Right? Sometimes it's just all over the place and then you don't know. Like estrogen is a hormone which is like, I describe them as sisters. So estrogen is a hormone which is like the fiery, flashy sister. She wants to go all out and conquer. And progesterone is a calm one. She's the one who will tell you, okay, sleep on time. But during perimenopause, progesterone levels start coming down because now we are the reverse of how we started our periods. So our ovaries and adrenals, they make these hormones. And if you haven't preserved your adrenals, you've been stressed all your life, again, you're ending up with an early
Rightly or wrongly.
menopause. Yeah. And as your ovaries run out of eggs, which is, so we are born with around maybe 300 to 400,000 eggs in total. And we run out of eggs, and that's what is menopause. So as we're running out of eggs in our ovaries, the levels of hormones are coming down. So if there is too much estrogen alone, you're like a wet cat. You don't want anyone to talk to you. You just want to be left alone. And maybe that's the time your partner will say, I need a cup of coffee. Or, it's not that he's bossing or ordering you around, but it's just that you've had too much in the day. And then this insulin resistance, you're having sugar cravings, and then you eat chocolates and you have sugar, gives you a rush and gives you a crash again. Or it is thyroid, and it's all kind of things happening together. Or you're having what is called this genitourinary syndrome of menopause, where you keep having frequent vaginal infections or urinary tract infections, and then you're not feeling that well, and someone just says, hey, can I, or your kid comes around and says, can you bake a cake for me, or I have this project to do, and you're just waiting to just blow up, like a dragon.
Talking about a wet cat, a lot of women experience dryness, and a lot of my friends would tell me this, and that never happened to me until it did.
Yes.
And that was so shocking to me. I mean, it was almost devastating. But I am here to tell you that it does come back. So tell us a bit about that.
Absolutely. So again, related to the hormones, estrogen, progesterone, testosterone receptors are in our intimate area. Right, so
Yeah.
the urethra from where we pee, vagina, all of these clitoris, we have receptors for the hormones. So as the hormone levels are coming down, naturally our genital area gets more dry, or you don't have the lubrication. The vaginal wall, vagina is like, it's basically like a canal, right? So the skin is like the skin on our face, or like the skin on our other parts of the body, the same kind of epithelium. And that, like you see, your face is getting drier, your skin is getting drier. So it's not just that you need some kind of moisturization, which some of the lubricants, they help when you're feeling very dry, but you do need estrogen in the form of some cream, or you need treatment for that.
I have another theory about that. I believe that if you're having regular sex, that actually really helps with stopping you getting
course.
dryness. I have something else I picked up. What was it said about this? Which I mean, me studying sex therapy and tantra, I've learned a lot about this. And it says, as you age, blood fills your genitals more slowly as you become aroused, which means you don't have the same sensitivity. And reaching orgasm takes longer, needing more direct stimulation of the clitoris. I don't agree with that. I think if you really are intimate with your partner,
Absolutely.
truly intimate, and having regular sex, I think this does not stand.
I agree.
Because
At all.
again, because see, when I have women who come in because in cosmetic gynecology, we do like vaginal
Which we
PRP.
do at Medicine and
Yes,
at Hortman.
Yes.
Yeah.
So again, when women come for, there is this new, O-shot where you're giving the PRP injections into the genital area for either enhancing pleasure. So again, orgasm itself is not, it's a little complex. as to how, because the whole process of the foreplay, of getting closer, libido, is all related to not just when you are doing the act, but
Absolutely.
it starts much
Starts
before
much
that.
before
I
that.
mean, it's of course.
Of course.
But I want you to explain the PRP because we know about it on the face. I mean, I used to do it on the face, in my aesthetic career. How does it work on actually the vagina itself?
So the PRP, we, as you understand, we take your own blood, around 20 to 30 ml, and then we are going to centrifuge it, turn it around, extract the platelet-rich plasma, which has growth factors, and then we give a numbing cream, and we are injecting it into the clitoris and into the anterior vaginal wall, which is the place where you are going to have the maximum nerve receptors for orgasm for women. And that is there have been studies, and still this is like a procedure which can help enhance not only sexual pleasure but also dryness, laxity, and even for some women, because the where we inject is where even your urethra is, so it helps women with the urinary incontinence also. And we combine this with either a laser vaginal rejuvenation, which does help. So it's like each woman is different, right? So each person's body is different. So we do have clients who come in for vaginal dryness, or if someone has had a previous breast cancer and they cannot take all of the HRT, so then we can offer them vaginal rejuvenation, which we do with the laser and vaginal PRP injections into the intimate area, and it does help them.
Okay, good. Irina, let's talk about nutrition.
Sure.
And how important nutrition is for perimenopause, premenopausal woman. And
Yes,
as we age
absolutely.
in general for longevity.
Well, as we mentioned before, it's your nutrition. We need to look much earlier on at our nutrition and our nutrient supply, and start thinking like for longevity, health span. We do talk to our clients, and we trying to put them into the space where they think about energy supply rather than just food supply. So every time you think about it, how much energy will it give? This type of food will give me. If it gives me enough energy to go X amount of time, then it's worth eating. A lot of the times we go for croissants, donuts, processed foods that would never give us any good calories. It's empty calories that we put into our bodies. And of course, what are we going to get out of it? Empty.
Yeah, so more protein. That's what, you're starting your day.
More protein. Start your meal. Every time you start your meal with protein, you balance your blood sugar levels. So it's already a good start for your body. And then, of course, phytochemicals, it's very important.
Yes.
Greens. Get your greens into, because greens will help you to digest those proteins, especially if it's not exactly mean and clean or clean and mean proteins, but more heavy ones.
Even if you're having your treat meal, I advise women have it with a salad, right? With each meal, add some salad, because even when you eat, the best way to eat is have your protein, have your salad, have the fiber, and then have the carbs last.
Yeah, I've heard that before.
Yes.
Yeah.
It's just a mental meal map. Start
Yes.
with a smaller plate.
And make sure what carbs you have, because some carbs are better than others. Why not go for buckwheat? Why not go for
Absolutely.
brown
Buckwheat, quinoa, wild rice.
brown rice, brown bread if you have to have bread, rye bread, the non-processed carbohydrates that will give you energy and slow release of energy in your body, rather than spike your insulin up, spike your sugars and of course insulin up, and then.
So I've started telling women, just don't eat anything from a packet. Right? If it's
Start from scratch.
Start raw, start eating more raw. And if you cannot, just add one cucumber, one carrot, and lettuce every day. Just do that. At least start with small changes. Because if you've been used to, so like you were saying, 20s and 30s, if you have been used to not taking that much care, I have myself not been a saint. So I have been there, done that, So, but after 35 or 40, I think that's the time you flip the switch into what you
More
eat,
healthier
what all you
ways.
put into your mouth. So I just remember words of Dr. Amen. He says, brain envy. Is this food good for me? Because whenever we are seeing food, or when you cross any bakery, right? The olfactory,
Smell,
our
yeah.
brain is tuned that the smell is going to attract us. Or if you have, these fries or
Especially if the
Oh,
food
wow,
that
yeah.
you absolutely love and I've
Love.
had it before.
So no problem. I
a lot
don't
of the
even
time.
call the food as a cheat meal. No, it's a treat meal. I've been a good girl. I've been doing exercise. I've been eating well. So I deserve the treat meal. Or if I have sugar cravings, okay, I advise women, if you're really having sugar cravings, just go brush your teeth. Maybe that will change your sugar craving.
And it
Or
does, actually. It
Just
does
have
work.
just have a cucumber, then have your chocolate. Or leave your phone, have it without it. Right, so that is small things which can really make a lasting difference. And again, time of sleep. When do you sleep? Make sure you don't skip your breakfast. You don't need to have a very hearty breakfast, but at least start your day with high quality protein. So if your weight is say 60 kilograms, you need at least 1.5 grams per kg of protein. So ideally you should take 80 to 100 grams of protein per day,
Which is quite difficult.
which is difficult, but we need to start somewhere, right? So at least 20 grams per meal, which could be, so one egg is around 9 grams of protein. So have one egg, have walnuts, if you're a vegan, try finding the sources of, plant-based protein. And that's when, yeah.
Plant-based protein is good, and also if you would like to increase your protein levels, reduce your carbs, because the minute you reduce your carbs, you would need to fill your body with something more.
Good tip. I like it.
Absolutely. And that's how you switch to protein more. Less carbs and good carbs, and more protein with
And fiber.
green vegetables. But also, lady, let's not forget about drinks. Foods are one thing. All foods are
important
going
thing,
through
yes.
digestive system, which we do get affected by foods, by sugars, of course, but not as much as we do by drinking it. And look what we have on our supermarket shelves. Juices supposedly healthy, full of sugars, full of
Read the label, yeah.
fructose, and based on
Lot of
fruits.
additives.
A lot of additives.
So if
exactly.
you cannot understand what's written in the label, it's not good for you.
It's not good for you
too
either.
Complicated.
Energy drinks.
Absolutely.
Oh,
How
terrible,
good are
yeah.
that for us? Not good at all. Or the same Coke, maybe not it's an energy drink, it's but we all know how much salt, how much sugars, how much carbs are in
And I think mindful eating really goes a long way. So I think we've been hearing about these injections, the weight loss injections.
Oh, yes. Ozempic.
Yeah. So the weight loss injections work.
I know so many women that have done that.
They
Oh, my
work,
goodness.
of course. See, if it is medically indicated and they are struggling with weight loss under the supervision of a doctor with the lifestyle change, we do need to prescribe them. But what I'm trying to say is how do these injections work? So we have leptin and ghrelin. These are the two hormones which control our appetite. Ghrelin is the hormone which is released when we are hungry, and leptin is the satiety hormone. So because we are not looking at our food and eating it, if you just look around, people are always on some
either on the
device,
phone or in front of the
device,
television.
and that's how they are
unfortunately.
eating. And that mindless eating doesn't cause the satiety. So look at your plate. I start with that smaller plate, mental meal map. Start eating slowly, and be grateful for what you're eating. Be thankful you have food on your plate. Chew, munch, eat protein, and you will be full.
Don't look into your phone or on the television.
Yeah, it's a big problem nowadays. Look,
It's
I
simple.
mean,
Actually, life is simple.
yeah. I tried the keto diet. It was something I was very against because I think it's too much fat, too much protein. But I have to say, it really worked for my body. It
But
really
exactly,
did.
it depends
cut
what it
all
works
the
for you.
sugar cravings.
Yes.
I had because I love my sweets. I always have my dark chocolate every day, which I don't think is too bad for you. As I've gotten older, I don't really eat a lot, but I did do this keto diet, and I had the food delivered to the house every day, and I found it really did work for me. I mean, what do you say about that?
Whatever works for you. Everybody has to. There is no plan as with Medigene. There is
No
no
one
plan.
size,
No one
fits
size
all.
fits
Yeah.
all.
Okay.
We need to find our
And also
perfect
your
as much as you
metabolism,
can,
yeah.
our diet or our ways of eating, and see how we feel. And ladies, I do believe that feeling how you feel, it's very important.
Absolutely,
How
yeah.
you feel after this meal, good or bad, and then take it from there. Next time, maybe do a little bit better. Better for you, not better for somebody else,
Yeah,
for
be
your
kind to
neighbor,
yourself,
but better for you.
I think, I mean, I was just on a retreat there for 2 weeks and it was vegan food. And I'm thinking, oh God, I won't have my protein because I'm a no blood type. And I think it's very relative what blood type you are
Yes.
also.
Yeah,
And
that's
I have to say, I did good on it.
Yeah, because
But it's
there are
good
so
to
many
change,
options.
ladies. It's good to change. If you are, for example, I'm very much a protein kind of person.
too, yeah.
I love my proteins and I have to have with every meal. But it's good to change. Like a lot of people nowadays do.
Detox or
And
gut reset.
Yes, do a
So
bit
it
of
takes
detox now and then.
48 to 72 hours, 2 to 3 days to reset your gut.
Yes.
If you're really struggling with gut issues.
Yes.
Yeah.
Do a vegan diet for a little bit. It may not be your cup of tea ultimately, but for a little while it's okay. It
Or
will
more
cleanse
plant-based.
you.
If you want
more
your chicken,
plant-based,
you want your meat, absolutely.
vegetarian.
Even if you're
Why
having
not?
your chicken, have it with the fiber.
I was
Because
watching a video the other day on this girl. She's 54 and she talks about all of that. And she was saying it's really beneficial if you could eat as many different foods as possible because then your gut works in a different
and
way.
then you have all the different gut bacteria. There are at least 12 to 15 million bacteria, gut bacteria.
Okay.
And over the years we have lost many bacteria as we
Yes,
have evolved,
absolutely.
because we have started eating more processed food. So it's just feeding your gut so that your bacteria, so there is prebiotic and probiotic food. So probiotic is the food which is rich in these bacteria, and prebiotic is the food which these bacteria eat.
Right.
So we need to have both prebiotic and probiotic so that we have different variety of bacteria in our body.
But I do believe that it's good idea to eat variety, absolutely. But it's also a good idea to eat local and organic for that region.
Right.
And then when you go to another region, also choose local and organic for that region.
And they also
seasonal
say
also.
seasonal,
Yes,
yeah, they also
absolutely.
say
But
seasonal.
for that country, for that region that
Yes.
you are in, for example, every time we come to Dubai, I come to Dubai, every time I
Dates.
try to, yes, absolutely. Dates number one. Other, for example, cheeses like halloumi cheese or something like that is produced here. I try to implement and to put a little bit
the
more
hummus.
into my diet. Hummus. Yes, so that I try different varieties of foods and types of foods too.
And even when you were talking about the keto diet, so keto diet or a fat based diet, actually, maybe 30 years back, people were talking that all fats are bad. But that's not true.
That's
No,
not true.
not true
Omega
at
3,
all.
and 90% of our brain is made of fat.
Yeah.
So for us in perimenopause or menopause, again, we need to have our omega 3, the good fats,
Very important.
to keep your brain,
Avocados.
or your walnuts, olive oil, the fish,
Yeah,
and and we even recommend omega 3 supplements, and it really helps with your cholesterol and the other things.
Krill oil is more pure. Have you heard of krill oil? It's a crustacean in the sea, and it's apparently higher percentages of omega
Omega 3
than.
and we also have cold pressed oil where it's not processed. So the sunflower and sapola, that's why now there is more trend for avocado oil or flaxseed oil,
But
right, which have the
also there is
omega-3.
a theory, bear in mind where you come from.
Because
Because of the region, try to have the oils that from that region. For example, I come from Belarus originally, and we have a lot of linen. So it's good for my body if you follow that theory to take a little bit more linen oil, and it's a very good oil too. When you come from
clarified butter, from where we come from, where it's ghee.
ghee.
Yeah,
Exactly.
so that's clarified
or for
butter
people
now.
who come from the Mediterranean region, it's great extra virgin olive oil.
Yeah, yeah.
So also But it's good to change, I believe, to try different and see how you feel again. I think it's very important.
So I speak to a lot of younger girls, and they always ask, well, how do you know you're perimenopausal? What would be the symptoms?
Oh, the first symptom, Dr. Priyanka.
So
Your
perimenopause is
periods.
when you are maybe 8 to 10 years before you actually stop your periods, right? So the average age of menopause is 51 or 52, and then they increase it to 54. But then maybe 8 or 10 years before that, you could start having these symptoms. So once you are maybe 35 or in your late 30s, if you are struggling with symptoms related to periods where they are becoming either too frequent or they get late, or you have any kind of intermittent bleeding, so that's abnormal bleeding. In terms of the other symptoms, the symptoms of perimenopause, we can have a whole laundry list of symptoms for that. Like there are more than 70 to 80 symptoms, starting from the brain, poor memory, brain fog, not able to remember things, mood swings. Even some women have tinnitus, that's they hear.
Ah, yes, yeah.
Vertigo. Then they can go on to feeling anxiety, palpitations, feeling their heart is beating too quickly, or some kind of panic attack where they just feel okay because the hormones are suddenly going down, which should be there, progesterone. And then again, loss of libido. And if you look at the genital symptoms, then problem with passing urine, dysuria, frequent infections, and so on and so forth. So there are so many symptoms. But it's just, the common thing is I'm not feeling myself.
Yes,
There's
exactly.
something wrong.
Yes.
So when you don't feel yourself and there's something wrong, and we have never actually
don't know what
tested
it is
your
exactly.
hormones. So we do a deep dive into your hormones. We want to check what's your progesterone level, what's your estrogen level at different time of the cycle. And even we check, there is the test for estrone, that is the bad estrogen. So that is the estrogen which can increase the risk for cancer if you have a family history of cancer or even otherwise. And we want to test your insulin, we want to test your cortisol, your vitamins, and maybe that's when so we are getting women who are in their late 30s who have been very active.
More and more often,
Absolutely.
right, Dr. Priyanka?
Yeah, so they've been, or they have had before maybe polycystic ovaries, so they've been struggling with that.
That's a problem. Yeah.
And then now they are like, okay, now this seems different. Yeah, we had a lady, she is a mother of 2 kids, managing so many things at home and outside, and now she feels she has this problem with her menstrual cycle. She has intermittent spotting, and when she has that, she feels there's a mood swing and she's feeling very low. So she was smart enough to say, okay, there's something going wrong. The day I bleed in between, in 10 to 15 days, I'm having spotting for every day or every other day, and those are the days I'm feeling really low. So she came in for a full hormone checkup, and we are now able to help her, and she's feeling herself back again.
I mean, look, when I came for my blood test, and I hadn't done one, I think, for over a year, maybe 18 months, and it came back that I had high cholesterol, I was in shock because I have really been well my whole life. And I did go and see a holistic doctor because I used to work with him 15 years ago, and he is amazing.
Now we know about it.
I mean, he was a GP, first of all, and then he studied naturopathy, and he's been doing it for 20 years. So he's not your run-of-the-mill naturopath. He's very detailed. And, he pointed out your liver is fatty and you're a little bit toxic. And once I did that detox and I did the 7-day water fast, honestly, I cannot tell you the difference I felt. And I realized that my inflammation was actually coming from the liver overload than anything else, because then my inflammation went away, the bloating went away. And this used to be a huge problem for me. I mean, it would completely change the shape of my body. And it was I'd probably say maybe twice a month I'd feel not bloated. It's a horrible feeling. And I always put it down to the imbalance of the hormones, but it was actually the liver overload. So once I thought I sorted that out, I felt much better since then. And I think that's quite a relevant.
So that's what we
Absolutely.
even suggest,
about.
right? So
We
we have
suggest-
women who are again coming in their 40s, struggling with this belly, the bloating, and not able to digest, not able to eat. They don't have
Yes.
the appetite. And then we do suggest, that the liver detox.
Liver detox is very
and also the IV vitamins, because often if your gut is not being healthy, then you're not even absorbing
Absolutely.
the hormones or the supplements and whatever you're doing. So
Yeah,
the liver
well, I've-
detox
yeah.
does help. So when that's what we are saying, we are eating too much nowadays. So when we are doing the fasting, you are helping your gut bacteria to start growing again. The good bacteria, the good guys, the lactobacilli.
Oh, okay.
Yeah,
So when you
because-
fast, they grow.
Absolutely.
Interesting.
So when you are fasting, you are not loading. So there are good and bad bacteria both. So all the processed food, when you have, so the gut is related to your brain also. Even the
Of
immunity
course,
is related
yes,
to
yes,
our
yes.
immunity, how we feel, our mood.
But
all
Dr.
of
Priyanka,
that.
you know that it used to be the first, they
Brain.
used to call it the first
First
brain.
yes, the gut
And
feeling.
then the gut
That's
feeling.
where the gut feeling
Exactly.
comes from.
Ancient Greeks, ancient Egyptians, Romans, they used to call it the first brain.
Absolutely,
And probably
yeah.
for a reason.
So
and
if
only
we have
then.
not been good with our diet, eating a lot of sugar hidden, sometimes it's hidden, stress, sleeping late, all of these things, alcohol, your gut bacteria are not able to grow. So when you do a fast, either a water fast or you're doing just the juices, if you're not able to manage with that, this is going to help reset your gut. That's just 2 to 3 days. Even 2 to 3 days is enough. So you could do that even every month, just
Yes.
for 2 or 3 days.
Yeah, I
have
used
only
to
juices.
do that. Yeah, and I was a big juice fast person.
And
Yes.
about the
Yeah.
cholesterol, not all cholesterol is bad. So the total
Yes,
cholesterol,
that's true.
the HDL, high density lipoprotein, these are the good ones.
Okay.
What we should look at is the VLDL, the low density LDL, and triglycerides.
Right.
So that is what is important. So that's what you need to keep in check.
And that's what we use to calculate P16.
Yes.
Right?
Yeah.
Triglycerides divide by LDL. And then we know the rate of aging for our cells.
Oh.
If it's low, it means that it's pretty good. You're doing
Your
pretty
cells
well.
are not aging.
If it's high, the highest I think it's number 2, then in relation where it is to number 2, then you know how you're doing with your aging process.
And how can you?
Because all of these unhealthy fats, the triglycerides and the LDL, are going to go and get deposited onto your heart. So you may not have any
Right.
symptoms, but that's why we are having so many young people, just suddenly they have problems with their heart because of all the bad fats which are
And men
floating
as
around.
well as women nowadays, we know that
absolutely,
estrogen, the level of estrogen also affects your
and again,
cardiovascular.
estrogen, progesterone, testosterone, they have more than 400 functions in our body. It is not, sadly, they have been called the sex hormone. So we are only relating these hormones with either reproduction or just having your menstrual cycle. But we need estrogen, progesterone, and testosterone for our muscle strength, for our bone strength, to prevent osteoporosis, osteopenia, weak bones, for heart health, and even to prevent cognitive decline and Alzheimer's. And there have been more than enough studies which have really reiterated that. And they stopped calling it hormone replacement therapy. Now it's just hormone therapy.
Hormone therapy.
Oh,
If you
okay.
don't have thyroid, we give you thyroid medicine. If you don't have insulin or it's not working well, we give you treatment for that.
And we would even
Similarly-
call it sometimes top-up therapy, no, Dr.
Top-up,
Priyanka?
yes.
Hormone top-up therapy, because we are actually topping up your identical hormones,
And
your
it's a
body
choice.
identical
I think
hormones.
women should be given the choice.
Yes, absolutely.
Dispel, dispel
Myth.
the myths about HRT, about the hormone therapy. As we age, all of us are at risk of heart disease, of breast cancer. These are the two main fears people are having with the hormone
Yes.
therapy. So when we see in absolute numbers, and now studies are coming, that in fact estrogen prevents breast cancer and prevents the heart disease. It's only the synthetic progesterones which were used before 2000, and that's when the WHI study was done. And that has really done a lot of damage to women's health. But now it's changing. The narrative is changing. A lot of women are now talking about menopause. We have amazing leaders talking about menopause, and also about, how women, even perimenopause. So women are aware of perimenopause and they are able
And
to
that we should start
make the
earlier rather
choices.
than later.
Yeah.
I mean, I have to say, in my experience, I was on the estrogen and the progesterone and the testosterone, and then I stopped the testosterone. And then, I always was a bit tired, low libido, and then I went back on the testosterone and everything leveled out again.
Again,
and now I
testosterone is
feel
not
very
just
well.
a male hormone. It's a
No,
female hormone.
It's a female hormone, but can we just talk a little bit about men and testosterone and how testosterone greatly affects men because there's a lot of men nowadays that have low testosterone, I believe.
So as women go, menopause is a part of aging. For men, it's andropause. But for women, at least we are able to say, okay, your periods are over. But sadly, for men, we are never able to tell them that, okay, you're in
Middle-age crisis, I
andropause.
suppose.
Yeah.
You call it.
And they often suffer in silence, right?
They get the 20-year-old girlfriend.
Absolutely.
Yes, that's a sign.
So they do then struggle with, weight gain, feeling tired, not able to exercise, not able to go to the gym. And then testosterone is a hormone which is linked to your drive.
Yes.
So
Zest for life.
we were talking, libido is actually zest
Zest
for
for
life.
life.
Yeah.
It's not just,
It's
having
not
sex.
just sex hormone.
Yeah.
Yes,
So
yes.
the zest for life is suddenly lost and you're like feeling tired all the time. So we do have men coming in for the BHRT also. And then when we check their testosterone, the free and the total, and then we see the levels, and we then start them on supplements and testosterone therapy, and they see the difference because they suddenly feel, okay, now I'm back at my game. And
Yeah, they say it's quite the wonder drug.
absolutely. Yeah.
Testosterone.
Yes.
And very often our patients, they bring their husbands. So that's how they see that their husbands are not feeling that well, so they talk to us and we suggest that they come and check the hormones level. Majority of the times it's testosterone
And it's really
deficiency.
helped them, yeah. And then it helps with
And it
relationships.
helps with the relationship as well.
Yeah.
Of course. I mean, look, I've been in the anti-aging industry for 25 years and there's no way that I was going to go through this naturally. I wanted to take whatever it took to feel normal again. Because even in my 40s, I was perfect. I didn't have any issues at all. I've always taken care of myself. And I think now at the age of 58, it's really paid off.
Absolutely.
Because of what I did. I mean, I
Taking
was
care.
taking supplements in my 20s and detoxing. I started in my 20s. So, what would you say? So, I want you to tell us how you can help us in your clinic, what we can do, what kind of tests, what kind of consultations you offer.
Yes, sure. So first of all, we offer the full analysis, hormone parameters analysis. So that's very important. Our programs are all include that blood test parameters. We check first of all, whenever whoever comes to us. We have various programs for our patients. That includes hormone balancing. If, for example, a lady is pretty young still and she wants to do analyze her hormones, get analyzed and balance it slightly, ever so slightly. Or we have a menopause relief program, andropause relief program that's specific for a specific condition. But for menopause relief, we have a lot of women who are already in perimenopause and they come for this program and doing this program. Then we also have longevity program or well-aging program, let's say. Again, it's all to do with our hormone levels. So we need to, first and foremost, we need to check the relevant parameters for each hormone. And then, of course, have a consultation with Dr. Priyanka, with our hormone specialist, Marketa Hakinen. And then we analyze the results of the hormone blood tests that we do for our patients. And we do an individual, personalized, very much personal individual protocol for each and every patient. And they are with us for 2 months and 4 weeks. We do a mentorship, close mentorship with every single patient.
So it's
doing
more of
Zooms,
personalized medicine, yes.
doing checkups on them. How are you doing? How are you feeling today? Better, worse? So that we know exactly where they are, our patients are.
Because often, unless we do a deep dive or into either it's your problem with the thyroid, insulin resistance, just perimenopause, your hormones are all over the place, or is it polycystic ovary you had before, or you had no problems at all, but you're not feeling well. All right, I do the test. And when they see that the levels, and often we need to start treatments even based on the symptoms. Like most of the women are coming with hot flashes, night sweats. We think it's related to estrogen deficiency. If they are feeling panic attack or they are not able to sleep, they don't feel relaxed, there could be a progesterone deficiency. There is lack of libido, lack of drive, they feel fatigued. That is sign of a testosterone deficiency. And then they see the difference. So when they get into and of course we offer them, because, women nowadays, they are taking a lot of supplements on their own. Without understanding, okay, vitamin
Why
D
they
take,
take it the
B complex take, B12 take,
Tell
all
me
kind of
about,
things.
I want you to explain the results of resveratrol and NMN. Can you tell us about?
We have a molecule in our body that is quite high during the age of 20-30. From the age of 30, while we are growing older and older, and we are growing older from the
Each
age
day.
of 1, we are not getting younger, we are not Benjamin Buttons, but normal human beings. So we are growing older every year. So that molecule, it's diminishing slowly but surely. And we cannot take this molecule in a pill format or a capsule format because it's too big. Our body would not be able to absorb it in any way. That is why M&M has been created. M&M does exactly that. M&M tops up your NAD,
NAD,
as we call NAD, in your body.
Which is very good.
So each cell has this powerhouse, which is called the mitochondria. And cellular aging depends on your mitochondria.
Right.
Are you able to age or not? And that is again why fasting is helping with longevity. That is why they are saying after the age of 40, you should do some kind of exercise which is going to activate the anaerobic pathway. That means you get a little breathless. So if you are doing exercise, which is of course under supervision, just a simple walk, that's good. But if you could just pep it up with a quick short run, right? A walk run, or you get a little breathless, 10 minutes of cardio, or just strength training, which gets you breathless. This is going to make at the cellular level, your mitochondria, which are the powerhouses, to live longer and to become, so that is what these molecules do. So NMN is, part of the NAD. NAD is what intravenous drips are given. But when you give it as a drip, it just goes off.
Yeah.
But when you
Within
take
a day or
NMN,
two.
And super expensive.
absolutely. So NMN, resveratrol, which is the active ingredient found in red wine or red grapes, quercetin, these are certain molecules which studies have been done for anti-aging or well-aging. That's important. That's how these work.
So the mitochondria part and also telomeres will always be increased if we put our body in some kind of a stress.
That's where the
but
cold
not
bath.
not a long-term stress, a short period of stress.
HIIT training.
Exactly.
Heavy weight training.
Cold showers.
Cold shower,
cold dips.
hot shower, or a cold bucket, that we could put
ice dip,
ourselves our ice dip. But
Many
if you
gyms
don't
are
do
offering
that,
ice
then
dips nowadays,
hot
People
and
are
cold
doing that.
shower does wonders too. And it's very easy to do it at home, in a home environment. You don't have to go anywhere. We just need to get used to it.
Because that's increasing the brown fat also in our body, which is again longevity.
Excellent.
So longevity is a multitude of things, right?
Of
we
course,
don't.
yes.
But how do we start? Because sadly, sometimes there is no marker that you are healthy and well. We have markers which can find out, okay, thyroid is not okay, this is not okay.
Where you are not okay.
But where are you
okay?
absolutely okay? You're in the zenith, you're at the peak of your health. There are no biomarkers.
Right.
So, that's what we work more towards, talking about longevity, keeping healthy, what you eat, how much you exercise, and the hormones. And
Absolutely.
That's how it goes.
Of course, one can do a bioidentical age, biological age
Testing, yes.
testing. So that's what P16. That's when we do triglyceride dividing by LDL. We look at that parameter, which is majority of the times quite actually good in our patients.
And what is
They're
that? What is LDL? What is P16? For our
P16,
viewers.
it's cell rate aging. So it's cellular aging, your rate of cellular aging. So you would know how quickly your cells are aging while calculating
that's what
P16
the triglyceride by the LDL
by
ratio.
the LDL.
Excellent.
Your cholesterol test.
So, on a final note, what would you say someone that's perimenopausal or menopausal, what's the best thing that they can do? What's the first thing they should do for themselves?
Check their hormone levels, first of all.
Check the hormones.
Yes.
Come and meet us.
Absolutely.
Have a conversation and then get your hormone levels checked.
And then you know exactly what to do and how you can go about it. It's a relatively non-expensive procedure, but you know where you are at.
Because numbers matter. Only when you have checked your numbers. So you checked your cholesterol, you got to know you did the detox and that helped you.
Exactly.
And then
If
it's
you have,
helped you a
not
lot.
done it,
Yeah.
then
Yeah,
we don't
yeah.
know where you are.
Where can we find you, Irina? Give us your Instagram name.
Yes, you can find us at medigene.com, medi-gene.com. We are on Instagram in Russian, medi_gene_Dubai, or in English, medi_gene_center.
Hartman Clinic.
Hotman Clinic, 1 Sheikh Zayed Road, very central. Anytime we are there, Dr. Priyanka is there twice a week. So please do call us, DM us, and we will be happy to see you there. Yes, assist you.
in longevity and healthy living and
As well,
aging well
specifically,
together.
specifically in during menopause, perimenopause, and even beforehand, fertility also.
Okay, and do you have an Instagram account?
Yeah, I am as Dr. Priyanka Mehta.
Okay,
That's what I
excellent.
am. Yes.
Well, thank you both very much. This has been very insightful, and I'm sure our ladies will find this very interesting. Thank you.
Thank you so much, Katrina.
Thank
Thank
you
you
so
for
much.
watching us, and I hope you've learned something today. I certainly have. Menopause is going to hit all of us without exception. So I think the more informed you can be, the more prepared you can be, then the less you'll be affected by it. Until next time, take care.